Transferable skills. From Cackle Media, this is Transferable Skills. I'm Noah Mishkin, and today's guest is Brenda Snyder, who shares her career journey from accounting into hospitalist physician. I hope you enjoy.
My first job after college was in hospital accounting. So I would pay the bills from the hospital, and I would also talk to the patients about getting their bills paid and how to get insurance companies to assist with that. And I found it very interesting working with the patients every day.
You're taking two extremely challenging, difficult disciplines for me, and you're merging them together. The first would be finance, and then the second is universal frustration, confusion, lack of transparency about everything related to medical billing and insurance and bills and all that stuff. And so you were handling a lot of that.
It's very complicated. And unfortunately, if you don't follow the right path, your bill doesn't get paid. So for me as a finance person, I could tell people what the steps were, what information they had to submit or where to send it to get their bills paid, and then assist them in how to pay their portion of the bill afterwards. I remember I had this little lady who came in, and her portion of the bill that she had to pay afterwards was about less than $5. And she stood at my desk and she counted out in quarters and nickels the amount she had to pay. And then we made sure that she had enough for the bus to take to get home. And then I was able to finagle a lunch voucher for her so she could have her lunch at the hospital before she left. It was very rewarding for me to help her with that.
I imagine the impact it had on you didn't end right there. That's a pretty profound moment.
No, it didn't. And in fact, I retired from accounting to raise my family, and I had 4 kids. And then coming back into the workforce, I decided what I really wanted to do is work with patients for the rest of my life.
Have you always thought of going into medicine as a practitioner, as a physician? Did you always have that interest, or was that something that you gained by way of working through the accounting side?
I was interested, but I didn't have enough confidence in myself to go for it immediately out of college. It was a transformation. In working with accounting, I learned that I like to work with people. And then in raising my children, I learned how to manage things and got more confidence in my ability to manage healthcare situations. Just when your son falls and scrapes his knee or has to go to the hospital to get some x-ray or a shot or something. And I learned more about healthcare, and then I started to get more confidence. So when I started back to school, I took nursing classes thinking that I would be a nurse, but the teachers were telling me, that question is beyond the scope of this class. And then after a few semesters of that, I decided to pursue being a physician.
It wasn't giving you enough fulfillment or depth within the knowledge of the medicine itself and maybe even the patient care.
Correct. I wanted to know why. Why does this medicine work? Why does this bacteria behave this way?
The why is, I think, the universal principle that leads people to develop further and grow into a career or even change careers. It's the why. It's the, what is the purpose of this? Why are we doing it? Who is this for? The why is ultimately the mission. What you were getting in finance was just kind of like the predecessor, but then nursing was the beginning of that, and it wasn't enough, and you wanted to go deeper further into it.
That's absolutely correct.
You had mentioned before that when talking to patients from the finance side, when you're working as an accountant, that a lot of it was clarifying the bill and understanding how it should be filed correctly in order to properly get reimbursed and for insurance to cover it. Who's ultimately responsible for making sure that is either coded right or that it is submitted correctly?
I think that it's a combination. I think that we have to work together. We in healthcare have to be conscious that this is a financial responsibility, and we have to be prudent in the tests that we order, the burden that we put on our patients. And then the patients also have to realize that ultimately they're going to have to jump through the steps and in order to get this bill paid so that they're not overwhelmed with expenses.
Yeah, it's a lot to deal with. Also, you're talking about a subject during a moment of potentially crisis or frustration, illness, all that stuff. There's a lot of cloud surrounding that moment that you're dealing with as a patient, as a family member of a patient even. to try to navigate that is challenging, even in the best of circumstances, let alone when things are very complicated, a complex health issue, or even a long stay at a hospital or procedure. It's got to be very difficult. Did you find yourself feeling like an advocate for the patients or more for the hospital?
It depends on the situation. Some people are very realistic and some people are very unrealistic. I'm in the middle and that's okay with me. I'm going to help them regardless. And whatever assistance that I can give them on their journey through the hospital, I'm going to get them there.
Your goal is just to be an aid, the best possible help and support for the person you're talking to.
That's correct. I don't pick who comes in the door. And every day is a new day and a new list of patients. And my goal is to increase your health and get you back to the life that you want to live.
It's a good goal. It's a good personal mission even. There's the mission of the company and the products and services, the organization that you work for, profit, nonprofit. And then there's the personal mission. It's what do I take uniquely to my role within this organization? What am I doing that's mission driven, that I feel a sense of individualized purpose? And it sounds like you had a very strong North Star there.
Yeah. And when it all works together, it's really rewarding.
Yeah, totally. Can you describe a little bit about what you believe the experiences and skills needed to do your job well as an accountant within the health system and how that might differ from being a CPA or another kind of accountant elsewhere?
So the health system being so complicated, I think that the background really assists me in being mindful of the way the hospital works and the way the patient's billing works. A lot of people don't realize this, but the hospital is paid per diagnosis. They're not paid per night. So it's to their advantage to get you in and out as quickly as possible, to restore your health as quickly as possible. And the average hospital stay right now in the United States is 2.5 days. And that's everything all averaged together. So heart surgeries, as well as appendicitis, everything averaged together is 2.5 days. A lot of people think they're going to come in the hospital and stay for a week. And that doesn't happen anymore.
Is that because we're getting better at treatment and therefore we're helping people recuperate faster? Or because we're just simply not covering it from an insurance perspective as much as we used to?
I think the focus has changed. We're definitely getting faster at getting things done in the hospital. Now we get things done in 2 days that used to take us a week. But also the focus is diagnosis and treatment. I get 1 day to diagnose, 1 day to treat. And then if you're not feeling well enough to go home, then you have to start considering going to a nursing home for a few days to get better, rather than sitting in the hospital for a week getting better. A lot of people don't realize that insurance is like Medicare. They don't pay you to stay in the hospital and just lay there. They will pay if you're having tests, if you're having surgeries, if you're having new treatments being tried, but they won't pay for you just to get well.
Yeah, it's not a hotel. As long as there's a purpose for you being at that specific location, being the hospital, because they have the diagnosticians, they have the tests they can run and the equipment there, then it sounds like the insurance's goal is to help cover those costs, but ultimately your stay should be elsewhere if you don't need those services.
Correct, because we're the highest cost. So moving through quickly is one of their goals.
That's very interesting insight. I think that I include myself in this generalization that most people assume that there's a cost per day, but the way you describe it is a cost per diagnosis or for the treatment itself.
That's right.
Maybe you can help clarify something else for me. When it comes to medical bills, it could be something as simple as I came in with a potential fracture on my foot. And so it's a sort of an in and out thing. Or it could be, God forbid, something that's multiple days, figuring it out, or something more serious. But even seemingly the simplest of services performed at a hospital, I'll get a bill. And as a patient, I won't know if should I pay this now or should I wait because there's going to be some sort of update to it, clarification by way of insurance, or someone's going to pay more, or there's going to be more charges added. I never know as a patient or former patient who have received services, if this is going to be the last bill or if there's going to be another one in 3 months, even for that very same day of service. But there's a confusion, I think, or lack of clarification or transparency when it comes to the billing part. And then if you look at it, so many things itemized on that the patient doesn't really understand or know why. I thought I just came in for someone to look at my toe. And why are there 3 different doctors on here? Do you think that today in 2024, there is any kind of increased emphasis from the health system to be a better transparent advocate for clarifying the services and what is being charged?
Well, we all definitely wish that it was an easier system.
Yeah.
Unfortunately, because it's a system that has been modified since the 1970s, and every modification causes it to be more complex. So when you get that first bill, you should wait till your insurance pays and then look on your insurance's form and see what they tell you to pay, and then coordinate with the hospital or doctor. The reason you have so many doctors is because sometimes the responsibilities are split. So the hospital charges you for the x-ray, but then you get another bill from the doctor who reads the x-ray. And you get a bill from the hospital from the ER doctor that saw you in the emergency room. In some places, because it's their group is employed by the hospital, but then there is some hospitals where that ER doctor's group is not employed by the hospital. They're allowed to work there, and then they bill you separately. So it all comes down to this old system that we have since the 1970s that's been modified and modified again, and that's why it's so complicated.
Unfortunately, that makes sense to me. I want to
blame Medicare. They started the whole ball rolling.
Yeah, healthcare has been for decades, generations perhaps, and continues to be a source of economic and political strife in our country, where we're always comparing against what other countries do, the ups and downs, the pros and cons, the benefits. I guess I would love to see more just simple transparency where you don't have to change the actual structure of how things operate or are built, but just a better clarification understanding, because people who don't understand medicine or people don't understand how hospital systems are run, they're just receiving a bill. And when I go into the store and go shopping for a car, for instance, I'm certain that there are a number of people that were part of that transaction, including the mechanic that made sure that used car is working, the floor sales manager who approved what it could be sold at, the bottom line, the individual sales rep. At the end of the day, I'm paying whatever the balance is, and we're moving on. And I think that you're right. It's an antiquated, archaic system. Maybe it doesn't need to be changed outside of just information. You felt a lot of that pressure talking to people who are just as confused, if not more than I am right now. And that was like probably a daily thing. And you felt you wanted to just help them. And that probably was both satisfying and frustrating to you as well when you could or couldn't.
Absolutely. And especially satisfying when the insurance companies behave badly.
Yeah. How long did you work as an accountant?
I think I was an accountant for about 3.5 years.
And then at that point, you decided to shift your work focus onto your family life, raising your family and managing your home. And then you got that itch, went to nursing school. Tell me about the moment when you decided to make that shift from nursing education into entering full-blown medical degree program.
It was a day off, and I was sitting in the bleachers watching one of my son's baseball games. He was about, I want to say 8 or 10 at the time. And I was reading the New England Journal of Medicine. How many moms are picking up the New England Journal of Medicine off the shelf and reading it just because one of the articles caught my eye? And I was thinking, maybe I should be a doctor. Loyola has a great program for people who are re-entering the workforce and already have an undergraduate degree. And I was lucky enough to be admitted into their program, and it opened a lot of doors for me. So it was a blessing.
Tell me what medical school was like for you, balancing family life, because a lot of people going through medical school are pretty early on in their adulthood and they have few other responsibilities, whereas you're balancing the full load of a working mother. How are you balancing your family life with medical school?
Yeah, it was a challenge at first, and I had to become really good at prioritizing worst first. So if it was a family issue that I had to attack, I attacked that first, and sometimes the studying didn't start until later that evening. And I became very good at time management. But my kids were a little older. I think my oldest was 16 when I went into medical school. My youngest was 10. It was a nice time in that I could learn how to balance both of them. And medical school was great. And I had lots of other older people in my medical school class. There was 6 physical therapists, a pharmacist, 3 EMTs. There was several nurses. We had a really very diverse class.
Your approach to dealing with situations worst case first sounds like a skill you picked up as like almost like a triage nurse. Where did you get that mentality from?
That's from dealing with 4 kids. I'll tell you that. But I use that every day now in the hospital. You want to get to the patients who are sickest first, and those who are doing better can wait a little longer and you can get to them later on in the day.
My approach to things every day is more like what needs to get done first, or what can I get started that will then be on like autopilot while I can move on to number two. Think of it like laundry. I don't have to sit there and watch it going around and around. I can literally throw it in while I move to operation number two. And then when that's done, move on. So this idea of addressing the worst cases first is very different from, I think, most people's day to day. Do you find that seeping into your daily life too? Or do you find things like, I just take them as they come, or this needs to get done at 9 o'clock, followed by 10 o'clock, more linear?
I'm pretty organized. As long as I'm taking care of the things that need to be taken care of first, everything seems to fall into place.
Looking back at your time in accounting, what skills were you utilizing then that you are now leveraging to better inform you as a doctor?
Just the awareness of the billing processes and the focus of the hospital. So sometimes we don't understand why a hospital administrator is asking you to do something or doing something this way. But when you look at it from a financial point of view rather than a medical point of view, then you understand the hospital has to keep its doors open. They got to keep the lights on. Sometimes they're going to ask you to use gloves that are not the same gloves you used for the last 20 years because the cheaper ones are better and they do the same job. Looking at things from both sides, I think, gives me a better perspective. And I'm able to share that with people around me because sometimes they don't understand and they get all upset. But then when I tell them why, then they're like, oh, okay, that makes sense.
Wouldn't it be great if we had that ability to have the duality, the dual knowledge in every part of our lives, professional, personal, where we could be able to take both sides of the perspectives and understand it better? I think that would make us all probably better people all around.
Yeah, absolutely.
In your job, you want to make sure that you're providing the best care for the patient. And in order to provide that care for the patient, you need to also make sure that the hospital stays open, that their doors stay open, that they're doing everything efficiently, cost effectively. So it's an interesting duality to balance all the time. And you're probably more sensitive than I would imagine most other physicians.
True. And when I talk to administrators, I speak their language. So when I have to fight to get a new test or a new treatment, I can explain it in terms that include costs. And sometimes that's the best way to get things done.
You gave a tip earlier that was fantastic, which is consult with your insurance company, make sure that you understand what they're covering and what you need to pay for. Do you have any other tips that would help people better understand and be able to decipher their insurance or their bills when it comes to medical bills?
Yeah, if you're confused, go ahead and call the billing office and ask questions. And they should be able to direct you and help you out. And they would rather take the time to answer the questions for you and help you get it paid rather than leaving it unpaid and a year from now trying to recoup that money when it could have easily been taken care of with an additional document.
Collections is never fun. It's not fun for the provider and it's not fun for the patient or the recipient of the services because it's going to negatively affect your credit. You're going to be dodging calls all the time that you really don't want to be receiving. Makes you feel icky.
Yeah, very stressful.
Yeah. And there's a very low percentage of collections that are fully recovered. The reality is typically settled and it has negative consequences for everybody. And it's just not fun. Not to say that it should be as easy as just pay your bills. I know there's a lot of people suffering and dealing with a lot of other costs of life that just make it prohibitive to some degree. And another commentary just on insurance and healthcare and all that stuff. And nothing that we're going to fix right here. But you can always hope for the future that things get better and improve.
And a lot of times it's just a very simple thing. Like the insurance company has a rule, they will never pay a bill until it gets submitted twice. So sometimes you just got to send it in again and that takes care of it. And collections people or the billing people can sometimes help you with that because they know more than you think they do.
They've seen this before. They see it a lot.
Yeah.
One of our sales teams, they kept a running log of the best excuses that people would have for why they either wouldn't sign up or wouldn't pay. And it was nothing but entertainment because all the excuses were just that and they were hilarious. And I like that they were able to make a mockery of it and be able to laugh it off as opposed to getting frustrated in that moment. Because when you do this all day, if your job is sales, customer service, collections, anything where you're consumer facing on the phone all the time, speaking to people all day, you've heard it all. You've gone through all the ringers, all the experience. That makes you both a little bit immune to some of the pushbacks, but also it makes you somebody that is very experienced, versed, knowledgeable in these areas. And your suggestion of reaching out and talking to somebody, it's very good advice because these people have seen it and they know what works best and they can be a real good advocate for you on the billing side.
That's right.
All right, you're a doctor. Just like that. I'm sure it was almost as quick and simple. Did you immediately find this fulfillment, satisfaction when you were practicing that? Yeah, this is what I was meant to do.
Yeah, absolutely. I definitely feel that this was what I was meant to do. I was transformed over a period of time into doing it, and I want to do it the rest of my life.
That's incredible. Everybody should be fortunate enough to find that job that gives them that level of satisfaction, fulfillment, and happiness and purpose in life too. I'm so happy for you that you have not just recognized it, pursued it, and are now living it.
Thank you.
What parts of your job do you find to be challenging and surprising?
It's challenging when I am unable to provide a quick fix or an easy cure. There are obviously diseases out there that I can't fix. And I've held more hands than I can count and done some death certificates when I had to. My heart goes out to these people. I wish I could do more. At this point in time, we just can't fix everything. And some people are ready for that, and some people will never be ready for that. And sometimes they get upset when you tell them that it can't be fixed and it's something they're going to have to deal with for the rest of their lives, or their life is coming to a close. And that's the hardest part of my job.
Do you think it's harder for you intellectually or emotionally? The intellectual side of, we can't figure this out from a science perspective, or emotionally, like, we can't figure it out. And I know that, and I recognize it now, and that's frustrating. But the emotional stuff is just, it's overwhelming, but it's something, it's a part of your job.
It's both. I will go back and read the literature and see, because so many things have changed in the last 15 years. I'll see if there's something else that we overlooked, some new treatment that's out there when there isn't. Emotionally, that's hard too. And the hardest part, I think, was with COVID was all the people who were passing away, because I was in the hospital every day. Sometimes all I saw was COVID patients all day long. And I was putting my own life at risk going into those rooms and being 2 feet away from someone who's coughing in your face and wearing that whole gear and knowing there was only limited treatments at first. Sometimes I was there having 2 or 3 people dying a day because of the COVID. But we all made it through, and it's starting to run out now, which is what we expected was 3 years. That's something that we can say that we did. We made it.
I don't know that there's anyone that doesn't have a strong level of appreciation and gratitude to doctors and nurses like yourself who put your life in jeopardy, put it in the front lines of battling this virus, because the beginning of it was massive fear. And part of that fear was the unknown. And so for anyone working in a hospital, they're just as susceptible as anyone else. And so I guess a big gratitude and thank you to you and other doctors and nurses and all the administrative staff that was going in regularly during those years. So thank you.
You're welcome. And thank you for your patience while we figured it out.
Yeah, I think patience is necessary, ongoing forever, everywhere. My sister was a nurse working at the Glenbrook Hospital, the COVID ward. She was there most days doing the same thing. And it was scary. It was scary to know that she was going in there. And it was scary to hear the few stories that she was able to tell. The rest of them, it wasn't something that she really wanted to talk about. And so the fear was real and the risk was real. The skills that you described about staying on top of the latest research and development about any kind of disease, virus, illness, solutions, treatments, is that something that is systematically presented to you? There's a process where you're just given the latest, or is that a skill that you have to own yourself and be autonomous about your own research and following up about things?
It's both. Part of my certification requires that I go to a conference every year, either by internet or in person. And I really enjoy it. It presents a lot of, this is the latest in this area, this is the latest in that area. And that really helps keep my skills up to date. But also I have to keep reading. And there's good resources out there with Cleveland Clinic Journal of Medicine and the Internal Medicine Journal. And so I'm out there and reading, not every day, but most days. And Up to Date is a good resource that we have in the hospital that we can look up side effects of medications. And because it's up to date. It has the latest research on it and it's very concise. I'm checking that quite often too. So.
Do you still get jazzed reading this stuff? Is it like exciting to you or does it feel like homework?
It's interesting to me. My curiosity gets to me and I have to read more.
There's something about further development, learning about new research and things that are happening in your space that you're a subject matter expert about that is energizing a little bit. It builds your knowledge set and something new to consider and how its impact is on your customers, your clients, your audience, your patients.
Yeah.
There are obvious skills with being a physician, all the things that you learn in medical school. What are some of the skills that you don't learn in medical school that you either brought over from your previous career or you have developed on your own?
In my current role as a hospitalist physician, I'm the internal medicine physician, so I'm the quarterback. So I figure out what's going on. I bring on consultants onto the case to help me fix what's going on or to do procedures that I can't do. And then I decide when the whole package is finished and ready to go home. Knowing people and networking, knowing who is going to take the best care in the most timely manner with the most financial responsibility, knowing that I think is a big asset. So I think in medical school, I didn't realize that knowing my consultants was going to be as important as it is now, because I know the guys who are going to come in and get the job done and get a good outcome for the patient, and we can get them out the door and they're much better for it. And I also know the guys who are not going to get it done in a timely manner or who have side effects, and those would not be my first choice. So I think that really helps in knowing the consultants around you, knowing what's available and knowing when to say, I can't handle this. I'm out of my depth. I need to pass to someone who can.
You're acting like a program coordinator, a coach, quarterback, all at once. You have to do this logistics, planning, and management while also being an actual doctor.
Yeah.
Were you always somebody that was good at networking, or was that something that you had to figure out?
No, I was never good with networking. That's something I had to learn.
Are you enjoying that part of the job?
Yeah, it's great. Get to talk to people.
Yeah. As a physician, you get in from medical school into practice. Do you have long-term goals of what you want to accomplish over the course of your career? Or is it just like getting better at the specific things that you do day in and day out?
I think that I've made it. I'm where I want to be. And I just want to continue to do this now. Medical school, right after residency, I worked in rural medicine for 2 years, which was interesting because when you're out in the sticks and you're 50 miles away from any other big hospital and you don't have all the specialties you need. And it was an excellent learning experience. I couldn't have been at a better place. I had an experienced physician as a mentor there, which was wonderful. And for the first 2 years out of residency, that was really great training. And then I transitioned to the job that I have now. And I like what I'm doing. I just want to keep doing it.
That's great. One of the things that had maybe delayed you pursuing a career in medicine was this lack of confidence that you could do this. And yet, right after medical school, you went to go work in rural medicine, which really you have to have a level of confidence. You're really out there on your own to some degree. You have to figure things out. You don't have all the access to resources like you would at a typical urban environment.
Yeah, that's absolutely correct. I was the first person in my family to go to college. I'm the first person in my family to be a doctor too. I had to just learn my own way going along. And the job that I got in rural medicine was only one of 2 jobs I had to pick from. And so I picked it and it turned out to be a really good learning experience. You look up a lot of stuff because it was in rural medicine and my family was here, I would work 7 on, 7 off. So I would go and live at an apartment next to the hospital for the 7 that I was on. And then I would come and move home and see my family the 7 that I was off. Living alone gave me a lot of extra reading time, which really helped. Again, that was just a blessing and another stepping stone in my career. And it's worked out really well.
Well, you found that confidence pretty quickly. I just want to say thank you. I know how busy you are, in not to be facetious but saving lives. But I just want to say thank you for being here, Brenda, for sharing your story, some of the skills from your past, from your current, and I hope the rest of your career goes well. And thank you for being here today.
Thank you, Noah. I think you did a great job today.
Thank you. You as well. I want to thank Chaim Baranowski for recommending Brenda as today's guest, and to you, our listeners, for joining us on this episode of Transferable Skills. Remember, if you found value in today's episode, please subscribe to the podcast, leave a review, and share it with your friends and network. Your support helps us reach more people who could benefit from these stories. Transferable Skills is produced by Cackle Media and music by Cos Monkey. For more resources and inspiration on leveraging your skills for a successful career transition, visit our website at www.cacklemedia.com. Follow us on social platforms at Cackle Media for updates and join our community of listeners who are all about embracing change and growth. If you have any questions, feedback, or want to share your own career pivot story, email us at skills@cacklemedia.com. We love to hear from you. Thank you for listening, and remember, the skills you've gained can take you anywhere. Until next time, keep exploring those transferable skills.